Okay, how about we get started? I think we got a pretty good group. What do you guys think? Yeah. All right, great. So I'm Candice and I'm the executive director at VIST. Thank you all for coming to our concussion series. This is week 3, and tonight we have Sonia Vovan speaking to us. Sonia is a registered physiotherapist with a clinical practice focused on concussion management and vestibular rehabilitation. She's been a board member of the Brain Injury Association of York Region since 2019, acting as communications director. She also serves as an executive member of the Neurosciences Division of the Canadian Physiotherapy Association. Sonia is involved with teaching physical therapy students at the University of Toronto in the neurological unit and vestibular selective. Her passion for knowledge and advocating for her patients led her to pursue her PhD at York University, where she's currently studying the implications of sensory motor changes and sex differences following concussion in working-aged adults. So join me in welcome Sonia.
Thank you so much for having me. So let me share my screen. All right, so my presentation's up and good. Okay, perfect. So thank you to BIS for inviting me to speak about exercise management for persistent concussion symptoms. And as someone, as you heard, who has worked extensively with concussion patients, I understand the challenges and the frustrations that you might be experiencing related to exercise in your recovery. So today we're going to explore evidence-based strategies to help you safely return to physical activity and optimize your recovery process. So I'll be guiding you through understanding how to find your sweet spot for exercise, that optimal level that promotes recovery without triggering or worsening your symptoms. Whether you're just starting to think about returning to exercise or you've already begun but you're struggling to find the right balance, this presentation will provide you with practical tools and strategies you can implement in your recovery. So before we begin, I just need to emphasize that while the information I'm sharing today is based on research and clinical experiences, it's intended for educational purposes only. Every concussion is unique, so what works for one person may not work for another. So it's essential that you consult with your healthcare provider before starting any new exercise program, discuss any specific concerns or symptoms you're experiencing, get clearance before you make any changes to your activity, and report any new or worsening symptoms right away. So I won't go through my background again, but basically this is all to say that I'm passionate about this topic and that I'm excited today to be able to share my experiences with you related to exercise in concussion recovery. But in addition to my resume is I'm on maternity leave now. So although I'm not seeing patients right now, this is what I'm focusing on right now is my baby. But of course, I am still advocating for my patients whenever I can. So today's presentation is structured to give you practical, actionable information that you can use in your recovery journey. So we'll cover 4 main areas. So understanding how exercise affects your recovery. We'll explore biological mechanisms that make appropriate exercise beneficial, and you'll learn why exercise timing and intensity matters. Learning to identify your personal exercise threshold. So we'll discuss specific methods to determine your safe exercise range. You'll learn to recognize both positive and warning signs during activity. Developing practical strategies for activity management. So we'll cover concrete tools for tracking and progressing your exercise. And creating sustainable exercise routines. So we'll discuss how to build lasting habits that support recovery. You'll learn strategies for long-term success. So before we dive deeper, I'd like you to maybe if you'd like to share in the chat, you can, but if not, at least maybe keep it in the back of your mind as we go through the presentation today. So so Candice, did you want to say something?
Nope, sorry, I just hit
Nope.
the wrong
Okay.
button.
Okay, no problem. Yeah, so either you want to share in the chat or you want to just keep in the back of your mind the following points related to what I'll be speaking today. So your current symptoms. So do you experience symptoms during exercise like headaches, dizziness? Do you have issues with balance or coordination? Are you dealing with fatigue or sleep problems after exercising? Um, think about your current activity levels. So are you mostly sedentary? Are you able to do some light walking? Have you returned to any structured exercise? And any concerns that you might have about exercise. So what worries you about returning to physical activity or continuing physical activity? And what has been your experience since with exercise since your concussion? So again, just think about these things as I go through my presentation, and maybe you'll have some information today that will enlighten you in regards to these points. Okay, so now let's delve into the science behind why appropriate exercise is beneficial for concussion recovery. So there's 5 key mechanisms that make exercise particularly valuable. So blood flow and brain recovery. So exercise increases cerebral blood flow, which is crucial for healing. So better blood flow to the brain means more oxygen and nutrients to reach injured brain tissue. Improved circulation helps remove metabolic waste products. So this enhanced blood flow can help reduce inflammation and promote healing. Neuroplasticity and healing. So exercise stimulates the production of brain-derived neurotrophic factor. So this is like fertilizer for your brain. It basically promotes the growth of new neural connections. Physical activity enhances this plasticity, helping your brain to adapt and recover. And this process is crucial for restoring normal brain function. The release of natural endorphins. So exercise triggers this release, which is your body's natural pain reliever. So these chemicals help improve mood and reduce anxiety. It can help break the cycle of pain and depression that can often accompany concussion. And also regular exercise can help regulate your body's stress response. Restoration of normal heart rate variability. So concussion often disrupts your autonomic nervous system, resulting in changes in heart rate variability. And heart rate variability is an indicator of health and recovery. So appropriate exercise helps restore this, which often then is correlated with improved overall recovery. And then breaking the cycle of deconditioning. So after a concussion, many people become less active. So this leads to physical deconditioning, which can worsen symptoms. It's a vicious cycle. So appropriate exercise can help maintain or restore physical fitness, and better physical conditioning can help make daily activities easier and less symptom provoking. So basically understanding these mechanisms helps explain why complete rest beyond the acute phase isn't always the best approach. However, the key word here is appropriate. Exercise must be carefully managed to provide these benefits without triggering symptoms. So now that we understand why exercise helps, let's talk about the crucial concept of finding the right balance. So I like to use what I call the energy battery concept to explain this. So imagine your energy level is like a phone battery. Each morning you wake up with a certain charge. Different activities drain your battery at different rates. Some activities recharge your battery. And the key is to never let your battery get completely depleted. Everyone has what we call a symptom threshold. So this is the point at which activities begin to worsen your symptoms. It's like a line in the sand. You stay behind this line, then you promote recovery, but you cross this line and then you might experience a setback. However, this threshold can change from day to day. Too much activity can set you back because it can trigger an increase in symptoms. It can lead to longer recovery times. It can cause inflammation in your brain, make you lose confidence in your recovery, and create a cycle of setbacks. On the flip side, doing too little can lead to physical deconditioning, like we talked about. It can increase anxiety about activity. It can slow down the healing process, create unnecessary restrictions in your life, and make returning to normal activities more challenging. So the goal is to find your sweet spot. So this is the amount of activity that challenges you, but doesn't exceed your symptom threshold. So it's different for everyone. It can change from day to day, and it requires careful monitoring and adjustment. So there's an art to this. So you can go too far one way and be at risk of a setback, and then you can go too far the other way and be at risk of deconditioning. So the goal is to stay balanced in the middle. So this requires awareness, patience, and it often means making small adjustments every day. And remember that finding this balance is a skill that does develop over time. It requires paying attention to your body, learning your personal warning signs, keeping track of your activities and symptoms, but most importantly, it means being patient with the whole process. So let's discuss the critical warning signs that indicate that you're pushing beyond your current threshold. So I'll break these down into two categories: red flags that are during activity and those that are post-activity warning signs. So for those during activity, it's warning signs that prompt you to either stop or to modify your activity. So, increasing headache. So, not just any headache, but one that gets progressively worse. So, pay attention to the intensity and location of the headache. A good rule of thumb that I usually tell my patients is if your headache or most symptoms increase by 2 points on a 10-point scale, then it's time to stop the activity. Dizziness or vertigo. So any new onset of dizziness during activity, any feeling like the room is spinning or moving, loss of balance, spatial awareness. So these symptoms typically indicate stress to the vestibular system. Vision changes like blurred, double vision, tunnel vision, nausea. So any feelings of queasiness, motion sickness. Yeah, and usually it accompanies dizziness and vision changes. Chest pain. So any chest discomfort should be taken seriously. It's not a typical concussion symptom, so it needs immediate medical attention. And then severe shortness of breath. So not just normal exercise related breathing changes. So it's a feeling of difficulty catching your breath, like you can't get enough air. And then in terms of post-activity warning signs, if symptoms last more than 24 hours after exercise, it might suggest that you've exceeded your threshold. If you start to experience sleep disturbances like difficulty falling asleep, waking up frequently, changes in sleep quality, or unusual fatigue the next day, mood changes. So increased irritability, anxiety, depression, feeling overwhelmed, inability to concentrate, physical exhaustion. So unusual tiredness, need for excessive rest after the activity. So let's talk about how to determine your safe exercise starting point. So the Buffalo Concussion Treadmill Test is a standardized clinical assessment tool that's typically conducted by a healthcare provider, and I'll talk more about that later. But if you don't have access to the BCTT, which is what I'll refer to it as now, you can use your age predicted maximal heart rate, which is the formula of 220 minus your age. And I'll also elaborate more on this later. And it's also helpful to keep a simple log of your activity, symptoms, and triggers to gain a general idea of your current baseline status. So the Buffalo Concussion Treadmill Test is a standardized exercise test used to evaluate concussion symptoms, assess recovery, determine safe return to activity timing, and develop individualized exercise treatment plans. So how it works is that you walk on a treadmill at a particular speed, and speed and incline increase at set intervals. We monitor your symptoms and vital signs. The test stops when your symptoms increase to a certain level or you reach maximum exertion. And then this gives us your threshold heart rate. We use this threshold heart rate to prescribe a cardiovascular fitness program that's individualized to your performance. And then typically you're reassessed every 2 weeks to evaluate your progress and to adjust your exercise program. The key metrics that are measured from this test include your heart rate throughout the test from beginning to end, blood pressure response, rating of perceived exertion. So here, this colored chart is an example of the rating of perceived exertion scale, where it can range from 0, which is not even here. So that means you're feeling very, very rested, to 10 maximal effort. So it feels like you're completely out of breath, and you can't maintain this for a long time. And then symptom scores. So then I'll ask my patient to rate their overall symptom level before throughout the test and then after the test. And I like this type of scale because not only does it show the number, but it also shows visually how you may feel in correlation to that specific level. So this test provides objective data about exercise tolerance. It helps to determine the threshold at which symptoms worsen. It can guide the development of individualized exercise programs and assist in return to play decisions. Now, if you don't have access to the BCTT, you can still find your safe exercise heart rate using the age predicted maximal heart rate. It may not be as accurate as obtaining a threshold heart rate from the BCTT, but by following the 7 stages, you can ensure a conservative and safe exercise progression. So here is an example. So for someone of the age 35, you calculate their maximum heart rate, which is 220 minus their age. So in this case, it's 185. And then you calculate the percentage of that heart rate for each stage. So stage 1 is 50% of the maximum heart rate, and it goes up by 5% up to stage 7, which is 80%. And typically, once you reach 80%, if you want to exceed that, you typically should require medical clearance. Otherwise, you can progress through these stages on your own, which is the benefit of doing it this way. So you start at stage 1 and you exercise at 50% of your maximum heart rate. You monitor your symptoms and you document your response. So how do you know to progress through the stages? So examples include no symptom increase during exercise, no post-exercise symptom flare, showing consistent performance at the current stage that you're in. And you want to make sure that you have at least 48 hours between progression attempts. In terms of safety guidelines, you never want to skip a stage. If you experience an increase in symptoms, you return to the previous stage. You want to ensure adequate recovery between sessions. You want to stop if your symptoms worsen, and then you want to document all your responses just so that you can track over time. Now let's discuss how to begin your exercise program safely. So starting small, the 5-minute rule. So start with just 5 minutes of activity. So this is for someone who may have not started an exercise program before and doesn't know where to start. You just start with 5 minutes. You monitor your symptoms during and after your activity. And then if you're successful, you gradually increase duration. So it's better to start too easy than too hard and then having to take a step back. So tracking progress, you can use a heart rate monitor, you can keep a symptom diary, take note of environmental factors like where did you exercise, and then record obviously the duration and intensity. Choosing a mode of exercise. So we'll talk more about it later, but you may want to start with lower impact activities, and you want to factor in previous exercise experience because maybe you just want to choose activities that you enjoy to start off with. In terms of environmental factors, you may want to look at, consider lighting conditions, noise levels, temperature, time of day, even the surface that you're exercising on. All of those factors can impact your symptom levels. And then warm up and cool down is very important to include because it's essential for symptom management. So let's build on these foundations to create a structured program. So the key program components, let's start with duration and frequency. So I typically tell my patients to aim for 20 to 30 minutes per session and to exercise at least every other day to allow for recovery between sessions. But of course, you can progress to doing it every day when you're ready. Use a heart rate monitor to monitor your heart rate while you exercise. So you want to use it consistently, stay within your target zone that you determined, whether it's through the BCTT or through your own calculations, and then track variations in heart rates response over time. And then in terms of symptom monitoring, check your symptoms before starting the activity, during the activity, and post-exercise, and even note 24-hour effects. I have a little asterisk here because, of course, symptoms may worsen during activity. So I don't anticipate that if you do an exercise, you won't have any symptoms at all. This is where I would then remind my patients about the 2-point rule. So as long as your symptoms remain within the 2 points out of a 10-point scale, then I consider that a safe increase in symptoms.
I have a question.
Sure.
Um, so if most folks don't have access to heart rate monitors or specialists or things
Yep.
like that, how do we create our own program, so to speak? I'm more of a qualitative person than a quantitative person. So, for example, what is the quality of my exercise? Do I feel symptomatic afterwards? Then I scale
Yep.
back, or I push forward when I feel okay, kind of thing, rather than
Hmm.
going, okay, this is my blood pressure, this is my my breathing
Yeah.
rate, this is too much. And it just becomes a chore rather than being fun. Like
Of
I like to
course.
spontaneously be like, ooh, it's nice outside. See the sun. Okay, let's go for a walk after work. That kind of thing. Like a more that kind of leisurely
Yep.
activity kind of person. So yeah.
Yeah. So this is where I go back to this slide here. I
Hmm.
think in that case, then the rating of perceived exertion scale and the symptom score level is probably your best indicators of activity level. And so what I tell people is to start at the 2 to 3 point level of the RPE scale. So it feels like you can maintain this for hours. It's easy to breathe and to carry a conversation. That's a good place to start. And then you would progress the duration of activity, staying within this level. Then you would gradually progress up this scale as you feel ready. And then same idea in terms of overall symptom levels. As long as your overall symptoms are in the mild range, then I think that's a good place to start. And then you can progress up from there. So I think that's a good qualitative way. And another good test is like the talk test, right? So it's kind of the same idea as this 2 to 3 score of this level is that as long as you can talk during the activity, you're at a good intensity. Once you're at a point where you can't have a conversation with someone, then your intensity level might be too high at that point. And then you can moderate that, adjust that as you progress through your exercise.
Is a chiropractor a person that can speak to things like that, or is not in their specialization, so to speak?
So my experience is that there are some chiropractors that have concussion experience, because a lot of these concussion educational programs, they are catered to all healthcare providers. It's just a matter of whether or not certain specialties will seek out that education. So I do know of chiropractors who do have that expertise, but not all do. So I think that's a good question to ask your chiropractor is, do you have experience and education in concussions? And for exercise, for cardiovascular fitness, do you have experience on assessing for my threshold? That's a valid question to ask.
Yeah, because my chiropractor was the one who uh, was the one to get me on the path to improving my concussion last year when it happened. Even the family doctor, physiatrist, nobody could help me. It was ridiculous. But he was the one who said you have to go walk to get the blood flowing, like the oxygen to the brain, and you have to move. Like be sedentary because that is the worst you can do to your concussion and things like that. And I didn't want to believe him. And then eventually I said, I'm suffering so badly. Let me try it. And he was right. Eventually, I progressed to be able to actually walk because before I was like unbalanced and you just feel like the world is teetering, like you're on a really rough sea water and stuff like that. And yeah, and then I was able to kind of like feel some changes and some stability and in terms of feeling progression instead of feeling
Hmm.
regressive, like kind of things like
Exactly.
I'm not getting better, like I'm like so concussed and things like that. But he was the one who actually was the first person who had the ability to make things better, so to speak.
Yeah. Yeah.
And
So
so
it
that's
doesn't,
why, yeah, that's why I'm
yeah.
like
So it
thinking,
can be exactly, it can be a physiotherapist, it could be a chiropractor, it could be a kinesiologist, athletic therapist. It doesn't matter what the healthcare provider's specialty is, as long as they have experience and education in concussion management. So what I'm going to do is I'm going to continue my presentation. Yeah, no problem. And take note of your questions and include them in the chat if you don't want to forget them. And then I'll answer them at the end, just so that I can go through this presentation completely, and then we can have a discussion afterwards. Okay. Okay, so where was I here? Okay, so yes. Now, in terms of mode of exercise and environmental factors, so we'll talk more about mode of exercise in a moment, as well as environmental factors, but you want to choose the appropriate settings, consider the time of day, account for weather conditions, things like that. And then in terms of warming up and cooling down, a general guideline that I provide is 5-minute warm up, a 5-minute cool down, but it can be longer than that if you need to. And then include some gentle stretching afterwards, just to help continue to reduce your heart rate after your exercise. So effective monitoring is crucial for success. So tools for tracking, so heart rate monitoring. So you can use a reliable heart rate monitor to record your resting heart rate, track your exercise heart rate, and note recovery patterns. And like I mentioned, you can use the rating of perceived exertion scale. So this is from 1 to 10, and it see how it can correlate with your heart rate. So for example, maybe you're at a particular heart rate of, let's say, 90 beats per minute, and your intensity level is 7 to 8. But maybe the next time you exercise, your heart rate is lower at 70 and you're still at the same intensity level. That's considered progression. And then you can keep a symptom diary, so you can record your symptoms before, during, after exercise. And like I mentioned, your 24-hour response is just as important. And then there's a lot of activity tracking apps, and there's more than these ones. These are just some examples, just to record your exercise details and track your progress over time. But you could even just use paper and pen. That's perfectly fine. So here's a chart that I've used with patients to systematically track their exercise progress. And this is what I will offer to them if they are unable to come in to perform the BCTT and they would like to progress their own exercise. So you first record the day and time that you are performing your exercise. You document the current exercise stage that you're in. So stage 1 is the example here. Then you write your predetermined target heart rate. So based on the age of 35 before, stage 1 was a target heart rate of 93. So before exercise, maybe your symptom level is 2 out of 10. You can document the type of symptoms that you have at the time. So let's say headaches. And then during exercise, you document your peak symptom score. You could even document the time when your symptoms increased to that peak, even specific triggers if you can think of them at the time, and then what symptoms increased. And then based on that information, then you can note down what the next stage is that you'll attempt. So because the symptoms here increased by more than 2 out of 10, they are going to remain at stage 1 for the next time that they exercise. So with this data, you can identify optimal exercise times. So maybe you determine that exercising at 9 a.m. is worse than, let's say, 4 p.m. It helps you to track recovery patterns, helps you to document successful progressions.
Can you go back to the slide for the sample?
This one here?
Hold on. Where? One more. The sample computation for your heart rate. Like when you're the age of 35, this is gonna be your heart rate.
Oh, so this one here?
Yes.
Yeah.
Okay.
So this is just, yeah. So this is just an example. So obviously you would make your own calculations based on your age.
Right. Thank you.
No problem. Okay, where was I? Okay. Yeah, and so basically Progress can include, so using this chart, you can see that you've progressed based on, for example, decreased baseline symptoms and exacerbation. Maybe you have increased exercise tolerance before the onset of symptoms. Maybe you've been able to increase the duration and intensity of exercise that you've performed at a target heart rate. And then obviously progressing through the stages is another way to indicate that you've progressed. So there's lots of ways, or even maybe the environment that you've exercised in. Let's say your heart rate and your symptoms haven't changed, but you've been able to exercise from a controlled environment to a more busy, chaotic environment. That could even be considered a progression. So let's discuss how to safely progress your exercise program over time. So you want to evaluate weekly, not daily, not every session. You want to look at, the overall picture. So review your symptom diary, your activity logs, look for patterns in your tolerance, note both, successes and setbacks, and then set realistic goals for the coming week. So measurement methods. So this is kind of like what we were talking before about the question. There's quantitative and then there's qualitative ways of tracking your progress. So quantitative ways is heart rate up, that's the most common way. The duration of your activity, so maybe you're able to go for longer. The number of rest breaks needed, so perhaps you need less breaks over time. The recovery time required, so perhaps instead of requiring 3 days to recover from an exercise session, you only need 1 day. And then obviously something simple like the steps or distance covered. And then in terms of qualitative ways to assess your symptoms, as we discussed, your energy levels after exercise, your sleep quality, overall feeling of well-being, and even just your confidence in exercise can be progression. So in terms of adapting to good days, so when you have a good day, resist the urge to do too much. Increase your duration before intensity. So if you feel good, increase the amount of time you exercise before the intensity. The maximum I suggest is 10% increase per week. Maintain consistent rest periods. So just because you feel good doesn't mean you should avoid resting. Those rest periods allow you to progress. And then in terms of managing bad days and setbacks, so if you experience one, just return to your previous successful level and then focus on gentle movement. So don't avoid movement completely, just reduce the gentle movement, maintain your routine, but with modifications. Note what were potential triggers for those setbacks, and then don't view this as a failure. It's all part of the recovery. So here's some guidance of when to progress. So if you've had consistent symptom control for 1 week, you have stable energy levels post-exercise, good sleep patterns, you feel confident with the level that you're at, and you have proper recovery between your sessions. How to progress. So it can be as simple as duration, adding 2 to 3 minutes per session. Frequency, so adding an additional session per week. Intensity, so like the chart I showed earlier, increasing by 5% of your target heart rate. Complexity, so adding different types of activities and movements. So perhaps instead of just walking, maybe you want to start adding, biking and elliptical use. And then the setting, so environmental factors, like I mentioned earlier. You can progress the lighting conditions, whether it's indoor, outdoor, whether it's even terrain, uneven terrain. There's many ways to progress the environment that you exercise in. So just remember, recovery is not linear. Progress at your own rate. Document everything so that you can kind of see where you're going, or you don't have to document, like we also discussed earlier, and just do it based on listening to your body. But celebrate all these small wins that you experience, because even that's why we don't want to look at day-to-day changes. We want to look at the bigger picture. So weekly progress or even monthly progress. So now let's talk about appropriate types of exercise. So walking is a safe starting point for most people. It's easy to control the intensity through pace and duration. It can be progressed by things that we discussed earlier, like duration. You can add incline, you can incorporate head movements while you're walking, changing the environment. But to be successful, I would say start on a flat, stable surface, choose quiet areas initially, walk during off-peak times in outdoor environments, and then have a backup indoor location just in case of bad weather. In terms of low versus high impact activities, I would suggest starting low impact. So that includes stationary bike, elliptical, Tai Chi even, swimming if that's that's of interest to you. And then you can progress to high impact activities like running, jumping, sport specific activities. Equipment. So some things to consider. So when it comes to the treadmill, some advantages are that it's controlled, it's easy to monitor speed, there's handrails available, but some disadvantages is visual motion, and it's not a natural movement pattern. And with a lot of my clients who have vestibular issues, there is a discrepancy between what you see and what you're doing. So you're moving, but you don't actually see yourself moving. So that visual vestibular conflict can be jarring. And then for the stationary bike, so advantages is that it's a stable position for balance, minimal head movement, and it's easy to track your heart rate on a bike. But disadvantages is that it limits whole body movement, and potentially there's neck strain or back strain from the position that you're sitting in. And then for the elliptical, advantages is that it's a full body workout. It's actually quite difficult for many people, but it's a good workout. It's low impact on your joints, and there's a nice smooth motion that it can create. But disadvantages is that it does require balance, and it may trigger dizziness initially. So let's elaborate on some environmental factors. So if you exercise indoor, you can control the temperature, the lighting, be protected from the weather. Perhaps there's fewer distractions and it's easier to maintain safety. But outside, maybe you do want to be out in fresh air, in the sun. You want to try different types of surfaces. Maybe you want to progress the noise level. There's lots of ways to incorporate outdoor activity. And then stretching. So, you may want to begin with gentle neck and shoulder stretches, especially since neck pain and neck issues are common with concussion injuries. And then you want to progress to full body stretches as tolerated. So it's just important to, practice proper breathing, slow movements, maintaining good posture, not holding your breath. So now we want to optimize our exercise. How do we optimize our exercise environment and routine to maximize success? So we can consider when is the best time of day for us to exercise. So some people prefer the morning. Perhaps, it's, you haven't gone through the day, so there's less cognitive fatigue. It sets the tone for the day. There's fewer, competing demands. You can kind of get it over with. But perhaps for some people, they prefer the evening. Maybe there's more flexibility in their schedule to do it in the evening. It just depends on their energy levels from the day's activities, and you don't want to exercise too close to bedtime. I would typically recommend at least 3 hours before bedtime. And then environmental factors, I've already spoken to lighting, to sound, to temperature. But so for example, for lighting, maybe you want to consider more natural lighting instead of fluorescent lighting. In terms of sound, maybe you want to consider the peak hours of the gym that you're attending, perhaps use noise canceling headphones. And then for temperature, it's better to exercise in cooler temperature, but generally you want to avoid extreme temperatures. So not too hot, not too cold. And, if you're going to exercise outside, just wear layers so that you can regulate your temperature by removing or adding layers. And then in terms of hydration and nutrition, so make sure you hydrate well before, during, and after. Maybe you want to have a light snack before just to provide you the energy to exercise, but avoid heavy meals. Maybe you want to consider electrolytes. If you're going to be exercising at an intensity where you will be sweating. And then following exercise, yeah, make sure you're well hydrated, have a snack if you need, and continue hydrating for the rest of the day. Now, I think having a pre and post exercise routine is really important to help set the tone for exercise. So for example, before exercise, you just want to maybe just review your symptoms, review your previous day's response to exercise, prepare the environment that you're exercising in, gathering the equipment that you need. And maybe if you want to do this ahead of time, then it kind of gives you the incentive to exercise. So let's say, for example, you plan on exercising the following morning, have everything ready the evening before so that it's all ready for you to go. And then following exercise, make sure you have a proper cool down period, do a symptom check, see if there's any type of strategies that you can use to help reduce your symptoms. So for example, if you have neck pain from the exercise that you've performed, maybe this is a good time to do some neck stretches, some self-massage to neck muscles to help reduce the neck pain. And then think about your recovery time and when you want to schedule your next exercise session. So remember, ultimately, that success comes from consistency in these practices. It's not about perfecting it. It's about finding what works for you and being consistent. So I think people typically like going through case studies and seeing how this kind of comes into play. So I'm going to describe 2 case studies that demonstrate how real patients of mine have applied these principles, and what were factors that I considered when I helped guide them through exercise progression. So for case study number 1, his name is Mike. He's a 35-year-old IT professional. His concussion injury was from hockey 3 months before I met him. Before his concussion injury, he was very active, going to the gym 5 days a week, working full-time, active social life, was able to do it all, and he wanted to do it all. So symptoms he had when he met me were moderate headaches, screen sensitivity, mental fatigue after several hours of work, and neck tension. So his goal was to return to work full-time, go back to his previous exercise levels, and he was really frustrated that he wasn't able to achieve this work-life balance that he used to have. So initially, what we suggested was kind of the following routine. So go for a 15-minute walk before work. It was part of his commute, so it helped. And then after 2 hours of work, taking a break and taking a walk around the office to get some more activity in the morning. It was important for him to take rest breaks throughout the day to manage his symptoms. He had a treadmill desk, so that ensured that he was able to get some activity during the day if he wished. And then near the end of the day, he did some gentle stretching to prevent his neck tension from getting worse. And then in the evening, once he got home, he performed light exercise if his battery level allowed him to. So strategies that were used in his case were strategies for screen use. So we talked about, what type of programs to reduce screen brightness, things like that. Vision care, so taking eye breaks regularly, neck exercises, and then gradual progression of exercise by incorporating exercise in his daily routine before adding additional exercise. So initially, he wasn't able to exercise every day after work, but because he had a treadmill desk, because he was walking to work as his commute, he was able to maintain those exercise activities. And then after 6 weeks of doing that, he was able to increase his overall battery level, his headache intensity decreased, his work tolerance increased, and then he was able to successfully introduce a modified exercise routine and get back to doing it 5 days a week as he wished before. And then eventually he was able to progress to his previous exercise level. And then case study number 2 is Lisa. So in her case, the focus was on adapting to setbacks. So she was a 42-year-old teacher. She sustained her concussion from a car accident 6 months prior to meeting me. And before her injury, she was moderately active. The main activities she engaged in were yoga and walking. The symptoms she had when she first started working with me was dizziness, balance issues, neck pain, and anxiety about movement and exercise. So for the first couple of weeks, we just started off with walking, some relaxation activities, and gentle stretching. And then week 3 or 4, we increased the walking, we added balance exercise, and she went back to light yoga poses. But this started to increase her symptoms again, and it was associated with certain yoga poses. So the following weeks, she reduced her walking. She continued to walk, but reduced the walking duration. She continued her basic balance exercises as long as they didn't increase her symptoms. And then she only performed yoga poses that didn't contribute to her increase in symptoms, which was neck pain. And then we added neck and shoulder stretches and rehab exercises to address that issue. So in her case, it was important to review her yoga poses with me to problem solve which poses were contributing to her symptoms. But what we did was modify those poses or just took a pause from doing those poses to reduce her symptoms, but to avoid minimizing further anxiety about movement. So I didn't want her to avoid yoga completely. So after 8 weeks, she had less anxiety about doing yoga, and she was able to eventually successfully return to a regular yoga practice. And she had a better understanding of her limits in terms of exercise. So key lessons with both cases is that it's really important to have individualized approach to exercise prescription. There's value to consistent monitoring. There's benefit to professional guidance, but obviously if you don't have access to professional guidance, that consistent monitoring and adaptation is important. And then it's important to address both physical and psychological components of exercise. So key takeaways for today is that exercise is medicine, but dosage does matter. There's such a thing as an appropriate amount of exercise. You want to start low, go slow, listen to your body, prioritize consistency over intensity, and remember that recovery is not linear. So celebrate those small wins, but look at the bigger picture. Okay. Thank you. So this is how you can reach me and find me. And otherwise, thank you so much for having me this evening, and I am open to questions and discussion.
Thank you so much, Sonia. There's some questions in the chat. Shall I read them out and perhaps you can answer them? Or
you know what? I can go through them. Yeah, I can go through them myself. So let's see. Okay, so what is normal heart rate? So normal heart rate at rest is around 60 to 100 beats per minute. And then with activity, that's where you can use that age predicted maximum heart rate and those percentages to determine what's considered normal in those ranges. Yep, but obviously it's also based on your symptoms. So you have a target heart rate, but then based on your symptoms, you work within a range. So I usually tell people, you know, plus or minus 10 beats per minute.
Okay, no, I was just since you were discussing about heart rate, I was wondering what's my normal. So you said that it's 220 divided minus my age, right?
Yes.
So I got 220 minus 39, my age. So I got 181.
Yep. So that's your maximum heart rate. And then from there, you can make the calculations for your target heart rate for 50% of that, 55, just depending on the exercise intensity and stage that you're at. But I always suggest going slow. So start with 50% of your maximum heart rate and then build up from there.
Right. Yeah. Because 180 I was surprised at the 181 max rate. So I was checking my my heart rate that is registered on my Apple Watch. So I got 106. So I was wondering if maybe I'm doing too less. This is my activity would be treadmill 30 minutes that time. It's a alternate walk and jog.
And you get a heart rate of 106.
Yep.
So the maximum heart rate, what I tell people is that that's not the heart rate that you want to achieve. You know, if you're at that heart rate, that means you're running a marathon, you're sprinting
Yeah, that's why
for,
I was very
yeah,
surprised.
yeah.
Because if that's gonna be my goal, 181,
No,
I don't know what I'm
no.
doing.
No, that's just to give you an idea of what you don't want to surpass, right? Because at that point, you are definitely going to experience symptoms, obviously. So
Right.
it's just based on your, so that's why it's not as accurate, because it's based on your age. And so it gives you an idea of your fitness, your fitness level, your health status, but obviously everyone is individual. So even a 35-year-old, if you have 35-year-olds, everyone will have a different response to exercise. So it's just guidelines. So it's just a starting point for you to start exercise and then adjust according to how you respond to it.
So you're saying 50%, right?
Yeah, 50%
if
of your maximum heart rate.
So 181 divided by 2, so that's 50%, right? So
yes,
that's 90. I think I'm okay.
Yes. I think you're okay.
Thank you for that.
No problem.
How do you measure the heart rate?
My background is that I had a major stroke caused by a ruptured aneurysm, and I had my rehabilitation and hospitalization, right? So with my rehabilitation and hospitalization at Toronto Rehab, they trained me well, and
That's great.
Yeah, they trained me well and telling me that you need to exercise so that you have neuroplasticity.
Perfect.
Your brain's gonna be good. So then that's why when I was I usually doing my exercise like an hour every day for like 5 days. That's my when I was at my optimum, I was doing that, and I lost
That's great.
I lost a lot of weight, and I think my brain is improved a lot. So yeah,
very good. Thank you for sharing.
Testimony that
That's
exercise
great.
helps a lot.
Exercise is medicine. Okay, let's look at the next question.
How do you measure the heart rate?
So usually a heart rate monitor, so it's usually a watch, but if you go to the gym and use the equipment there, sometimes they have sensors that you could place your hands on. Those are not as accurate, but if you don't have a heart rate monitor, you can do that. In terms of heart rate monitors, there's such a range in terms of accuracy. So you can go as simple as a Fitbit, you can go as complex as an Apple Watch. I tell people, these target heart rates are a guidance. So let's say your target heart rate is 93. You don't want, it doesn't matter if your heart rate is exactly at 93. I always tell people, as long as you're within 5 to 10 points. So, within 5 to 10 points of 93, then that's sufficient. But that's how you would measure heart rate, is a heart rate monitor. So whether it's a wrist heart rate monitor, a chest heart rate monitor, or using exercise equipment. Okay, so if somebody's restarting exercise after a long period of inactivity, does it alter the heart rate levels and pacing one should use? Yes, definitely. So as the point that I mentioned in one of my slides about deconditioning, it can alter your autonomic nervous system and your response to exercise. So at that point, it's like I said, it's better to start low and go slow. So just start from the beginning again and see where you're at and reassess your symptoms from there. It's almost better to exercise and feel like it was too easy than to restart exercise and realize that it was too tough and then having to go back from there. How do we do the Buffalo treadmill test if going on the treadmill already makes us dizzy? So there is also something called the Buffalo Buffalo Concussion Bike Test. So there is a way that clinicians can modify the test so that they can do it on a bike. It's a little bit more challenging in terms of progressing the intensity on a bike, not like a treadmill where you can just increase the incline and the speed, but it is doable. And in terms of if there isn't a bike, I always, when I do the treadmill test, I tell my patients, you can hold on to the bars. That doesn't affect your symptom response to the test. And if it does make you too dizzy to do the test, then you can just do the alternative method of calculating your age predicted maximal heart rate and progress from there. Okay, and then I can't handle bright lights, noise, vibration, so I can't go to the gym. It's cold outside going into winter. So some things I have suggested to clients is to maybe go to the mall during off-peak hours. I know the lights is not great, but at least during off-peak hours, you can avoid noise. So maybe, early in the morning or late in the evening when the mall is not as busy, you can use that as a place to walk. If you live in a condo, maybe walking up and down hallways. There are some community centers that allow people to use their, what do you call it? Like walking areas where you can walk indoors. So those are the alternatives that you can use instead of going to the gym.
But I do a lot of walking. It's more like my chiropractor suggested I increase my cardio. Even my physiotherapist suggested that too.
Yeah, so in that case, you can progress, the speed of your walking. Yeah, you can increase the duration of your walking. Depending on how you walk, you can, adjust like the environment that you're walking in. So, yeah, so
Like for
those are ways that,
example, is there like something like um maybe I could do at home instead of going on a stationary bike
oh, yeah.
at a
So,
gym?
yep. So what I have also suggested to some of my clients is on YouTube. There's great like walking exercise workouts. So it's just based on marching on the spot, but then they might suggest like walking in a certain direction, walking at a certain speed, adding arm movements. You can get quite a bit of workout marching on the spot. So that's something that I've suggested to clients of
I
mine if
s-
they
I
don't.
s- I like started the wall push-ups because I broke my arm before, so that was my physio exercise. So I started doing that. I don't know.
Yeah.
That was like killing two birds with one stone, that kind of
Yeah.
thing. And is it maybe even crunches, like sit-ups kind of thing? Like maybe that's another thing because I need to lose weight. And I don't know what else
So
more you could do, like maybe like light
yeah.
weights, like actual weights that you can get, like dumbbell kind of thing, like.
So it depends
I
on
don't
your
know.
situation, but there's a
Mhm,
lot you could do at home. There's so many things you can like so many body weight exercises. You can use equipment that you have at home, whether it's cans, bottles, um,
mhm.
things like that, the wall, like you said, furniture even. So there's definitely like during the COVID pandemic peak, there was a lot of indoor home exercise programs that were presented. So there are definitely ways to exercise from home that can still give you that cardio,
Like
that feeling
is
of
that the
cardio.
is that the goal really, is to increase the heart rate through cardio exercises? So I already have like walking integrated into my routine or even just additional stuff to do errands, but I just want to increase that because I kind of feel like it's like I wouldn't say stagnant, but it's kind of like plateau where walking isn't that word
Yeah.
challenging my
Yeah.
body. Yeah.
So it depends on each person's goals. So for
Hmm.
some people, maybe their goal is to increase their heart rate with exercise. Maybe some people is to reduce their symptoms with exercise. Maybe your goal is to increase the intensity of the exercise. So you want to go back to high impact exercise. So it really depends.
I want it to be
Heart,
normal and also to be able to tolerate all these other things like lights and sounds. I'm just wondering, does increasing blood flow, like the oxygen to your brain, does that actually recover the brain faster, or is not necessarily meant for
Oh,
that?
yes. There
Okay.
is, yes, that is one of the main, main reasons for exercise and reasons why it's prescribed after a concussion injury is to increase blood flow to the brain. There's so many benefits to that and lots of evidence to show that.
Yeah, everyone keeps telling me to go swimming, but I cannot swim. Like I literally sink to the ground. That's not a good idea.
It works for
Yeah.
some people.
Yeah, I don't know. Cool, thanks.
Okay, no problem. So yeah, so a comment here is that, exercising with blue tinted glasses, a hat with earplugs, exactly. So there's ways to kind of modify your ability to exercise in different types of environments and whatever works for you. It's trial and error. Sometimes you don't know what works until you try it and then see if it helps your symptoms. So do you think the Apple Watch heart rate is true or reliable in your experience? So of all the wrist heart rate monitors, so Apple, Garmin, Polar, Fitbit, I have noticed that when I conduct the Buffalo concussion treadmill test, I always use a chest strap monitor because that's the most accurate. And if my patient is wearing an Apple Watch and we kind of want to test and see how congruent they are, I have found that those who wear the Apple Watch, their heart rates are the most congruent with my chest strap monitor. And then I would say Garmin is probably, Polar is probably next, and then Garmin. I would say that unfortunately Fitbit, even though it's a popular brand, is one of the more inaccurate
Thank you
heart rate
for
monitors.
sharing that, and I appreciate the information.
No problem. Can you share the presentation? Yes, I'll be sharing this with BIST and then they can forward it to everyone. Do I have a heart rate monitor? Yes, I use my Apple Watch monitor, but like I said, if I'm assessing a patient, I use a chest strap monitor to ensure accuracy. And yes, if you want to check your own heart rate and you don't have a heart rate monitor, you can certainly check your pulse. So you can check your pulse from your wrist, from your neck. And what I typically do is 15 seconds and then I multiply that by 4, but you can also do 10 seconds and multiply it by 6. It's just that it's a hard way to monitor your heart rate during exercise, because let's say you're moving and then you have to you want to check your heart rate on your wrist or your neck and you're moving at the same time. It's just hard to be able to capture your pulse with activity, but it's obviously doable. Are there any exercises that are a complete no-no? Jumping, skip rope. So again, it really depends on your situation. So, for example, if you have vestibular issues, maybe, spinning and turning type of exercises may not be appropriate. Maybe if you have neck injury, then, bending over, jumping exercises may not be appropriate. So it really depends on your situation. If you're unsure, you can always get assessed by a healthcare provider and then determine if that type of exercise works for you. Otherwise, if you're wanting to determine on your own if the exercise is appropriate, you can try it and see whether it provokes symptoms. And then that's an indicator that it's an exercise that you may want to avoid. It's been almost 7 years. Cardio. My symptoms get worse. Okay, so I hear this a lot where while you're doing exercise, the person feels better, their symptoms reduce, but that their symptoms tend to come on after exercise or that it's even delayed. So what I always suggest in those cases is to integrate relaxation activities after your exercise. So that can include breathing, meditation, stretching, anything that helps to reduce your symptoms and heart rate right after the activity. Usually, but obviously it depends on your situation, it helps to manage your symptoms so that you don't experience that delayed response in exercise activity. Because typically what happens after concussion injury is that your heart rate recovery is slower. So, typically, let's say before your heart rate would have recovered from exercise within let's say 15 minutes after a concussion injury, maybe it takes an hour for your heart rate to come back down from, let's say, 100 to 60. So by doing some sort of relaxation activity after your exercise, it can help to reduce your heart rate to baseline quicker. A small trampoline helps circulation and joint pain. Yes, I've had a lot of clients who use trampolines. Obviously, it depends on your situation. Like if you have vestibular symptoms, then that might not be so fun. Do you have advice on nutrition or resources we can check out? Yes, so I can include that in my presentation, and then when I share it with this, you can find that in one of the slides. I'll include it at the very end of my presentation. What type of treatments can you recommend for confirmed injuries such as post-concussion, whiplash, physio clinic? Yeah, so of course I can't recommend any specific type of treatment for specific situations. So I would suggest going to a clinic. It doesn't have to be a physio clinic like we talked about before, but basically a clinic that has a provider that has expertise in concussion management. And I always tell people, I mean, obviously once patients find me, it's different, but if someone's looking for a provider, I always say, don't be afraid of interviewing potential clinics and providers, don't be afraid to ask, what's your expertise? What's your educational background? And, asking the type of questions so that you feel comfortable seeing them as your healthcare provider. Just like a job, working with someone in terms of your rehab is just as important to interview.
How do you find a health concussion manager?
Pardon me?
How do you find a concussion manager?
So you mean someone who provides concussion management?
Yeah.
So, so for most people, they go based on convenience. So they'll contact a clinic that's close to them. So you can contact the clinic and then you can ask them, do you have a healthcare provider who has expertise and education on treating concussions? And then from there, they'll let you know. And then you can always ask, what is their level of experience? And then you can decide and make that judgment if that is someone that you would want to work with. But it's as simple as just asking if the clinic has someone that provides concussion management. Unfortunately, there's no like directory, there's no central place where you can, find a list of healthcare providers who provide concussion care. It's more so just asking to see if your local clinic provides that type of care.
Oh, I have a caveat for that. There's lots of
Yeah.
places that would claim that they are concussion clinic. Don't believe them. Some of them even double charge you if you say you have a concussion, like for the physio
Yes.
treatment and stuff like that. That's what I noticed when I called around. So then I was like, what the heck?
I know. And unfortunately, you could say that about a lot of expertise, unfortunately. So that's why I say asking questions is important. So I always say, ask, what's your education? What's your caseload? I think that's actually one of the more important questions I would say is, do you primarily see patients with concussions, right? It's one thing if, let's say it's a physiotherapist and they have a very generalized practice where they see all diagnoses, then if they don't see enough patients with concussions, they may not have developed that clinical experience. But if a physiotherapist sees, 80% of their caseload are concussion patients, then you can have more confidence that they've seen enough scenarios to be able to provide that type of guidance. So I think that's a good question to ask. But yes, unfortunately, it's really hard to be able to filter out. And that's why the questioning is really important. After I have breakfast, what time can I go to do an exercise? I typically say at least wait an hour after eating, but it also depends on what you eat for breakfast too. If you have a light breakfast, maybe you can exercise sooner, but if you have something heavier, waiting 2 or 3 hours might be more appropriate. I would say like you want to start exercising when your stomach doesn't feel like if you can feel like you have something that is in your stomach. If you feel like you can still feel food that is digesting, you're probably not ready to exercise yet. 3 years ago, Biz had a webinar by a nutritionist. Yeah, so you know what? BIST and a lot of these brain injury associations, we do have nutrition providers, dietitians who come on and do a lot of talks. So that's a good resource for nutrition um, information. That's a good place to start. And then those providers probably have their own resources for nutrition after a brain injury. So I think that is a great place to start. I know, for example, for the Brain Injury Association of York Region that I'm involved with, we've had a talk by a nutritionist, and she provided her slides to the attendees as well, and had great resources. So that's a good idea. Okay, what if we are too fatigued and nauseated to get up and can't exercise? So there could be like a more medical reason for why you're unable to exercise. So you may want to seek medical clearance before you consider exercise. So if it's to a point where you're just like, there's no possibility of movement, you might want to look into that. But let's say you can't get up and exercise, maybe exercise in bed, right? So you can just do gentle movements in your bed, lying down, moving your arms, your legs, whatever you're capable of doing in a lying position, and then see if you can progress from there to a sitting and then a standing position. If you're able to do that, that's a good place to start. But if you're in a situation where you are too symptomatic to even get up to exercise at all, I would definitely seek medical advice. I walk to shopping because walking helps digestion. Yes. Before my car accident, I did a BJJ weightlifting. I feel like I have about 2 minutes and becoming symptomatic and experience my second concussion. So, I think that's a good point, is kind of reevaluating the type of activities you used to do, and what you want to do and what you're capable of doing after a concussion injury. People say it's like a new normal after a concussion injury, or a new sense of self after a concussion injury. It's not that one is better than the other. It's just, a new season of life. And perhaps, if you're unable to return to a certain type of activity after a concussion injury, there's lots of alternatives that can be just as satisfying. It's about seeking those alternatives and being able to determine what those could be. Exercise is one of the recommendations. Yes, you're welcome. You're welcome. Can I use Zumba for older people? Yeah, Zumba's fun. Dancing. I mean, I think that they're fast moves though, but maybe you can modify Zumba so that they're slower if you want a slower type of exercise. But, dancing, dance aerobics is definitely a great way to exercise. And that's something I didn't mention, is the social aspect of exercising. So maybe you like the accountability of exercising in a social setting and in a group. So that could be something to consider, right? So for example, that your community center has a group exercise class every Monday evenings. Maybe you want to do that because it makes you accountable to that. And then you have this socializing aspect with other people. So that's a great point to make. Incline. So in terms of like treadmill and walking and incline, so let's say someone doesn't want to, or has difficulties progressing the speed of their walking, incline can be a way to progress. But I typically find that incline progresses the symptom intensity a lot more than duration. So which is why I usually suggest adding that later. So I would suggest progressing the duration of your exercise first, so up to 20-30 minutes. Once you can walk for 20-30 minutes at a comfortable speed, then consider incline. Because once you add that incline, your heart rate does increase significantly. But it is a great way to progress your exercise. Thank you, Wynn, for all of these different suggestions. Walking up and down the stairs. Yeah, that's a great indoor activity. Good idea. Sometimes I need to have a stick to walk. Yes, of course, that's okay. If that allows you to walk and incorporate exercise in your routine, then using a stick is perfectly appropriate. I use a finger oxygen level monitor that also gives heart rate. Yep, that's right. What type of education certificate qualifications? Okay, so this is tough because there isn't like a standardized certification qualification for concussion providers, unfortunately, but there are a lot of concussion education programs out there that do provide comprehensive courses that if you see that a practitioner has done that type of course, you can feel confident that they have had extensive education. So, for example, there's a program called Shift Concussion Management, there's Complete Concussion Management, there's R2P, there's lots of different types of qualifications. But like I said, it's one thing to have the qualification, but it's another thing to apply it. So someone could have gotten a qualification, but then they don't see that many concussion patients, so then they don't apply what they've learned. I think, like, this is my personal opinion, is that I think what's more important is whether they see a lot of concussion patients or not. So I think a question, like I said, again, a question to ask is, how many concussion patients do you see in a week? What's your percentage of caseload seeing concussion patients? I think that's more important. How about not feeling like exercising due to mood? Yeah, that's a tough one. So, it's one of those vicious cycles too, because you may not feel like exercising because of your mood, but exercising can improve your mood. So I think a good place to start when it comes to that is finding a type of activity that you enjoy. So maybe there's an activity that you used to enjoy prior to your concussion injury that you want to return to. So find a modified way that you can incorporate that and see if that can help get you kickstarted on an exercise program that can help to increase your mood. However, if your mood is such that it's really impeding your ability to engage in daily activities and exercise, then I would, of course, recommend seeing a medical provider to see if that needs to be addressed before exercising. Yes, being outside, walking in the sun does help with mood. Do I need a professional to do the pub flow concussion treadmill test, or can I do it myself? So this is where my medical disclaimer comes in. And I would say that, yes, you should have it done by a professional, because what can happen is that if you get to a certain point on the test, your symptoms increase, your heart rate increases, where the point of the test is to push you past your threshold. You may get to a point where your symptoms are can impact your ability to continue the test, and then you could be at risk of injury and falling, let's say, right? So that's where being with a professional is helpful to ensure that you're safe during the test. But of course, if you don't have access to a professional, you could attempt it yourself. But again, caveat is that you want to ensure that you're safe, right? So you want to ensure that you're in a safe environment, using the clip on a treadmill so that it can stop if you fall off, worst comes to worst, or you can just do the age predicted maximal heart rate alternative to be safe. But ideally, you should get it done by professional. And another thing too is that if you get it done by professional, you don't have to think about all the different metrics that are involved in testing, right? So all you have to do is focus on walking on the treadmill, and then someone else is dealing with, tracking your heart rate, your symptoms, your exertion level. So, sometimes that multitasking can make the test difficult. Can we perform the upping maneuver on ourselves, or should we go to a physio? So this is not something that I spoke about in this presentation, so I'm not going to discuss that here. Do you have a preference for Tai Chi versus Qigong as a beginning exercise activity? So although I know of Tai Chi and Qigong, I am not too familiar with it. So I can't say if one is more appropriate than the other, but I do know that they're both low impact. So I think it's a matter of trying them both and seeing which one works better for you. Before the accident, I was taking Tai Chi, tried again after a year, but it was awful for my neck, so I had to stop going. Yeah, exactly. So you don't know if something works until you try it. So, although a lot of people recommend Tai Chi because it's seemingly low impact, it may not be appropriate for everyone. I have severe sensitivity to vibration. Is there a treatment you might recommend? Unfortunately, I can't make specific recommendations in this presentation. Okay, I think that I don't have insurance. Okay, so there are some clinics. I have to look at my resources, but I believe there are some clinics. I don't think it's covered by OHIP unless you've had an acute concussion injury or within a certain window of your recovery. Otherwise, unfortunately, most healthcare providers, you do have to pay out of pocket, but I can always provide this resource to BIS and then they can forward it to you. And this is information that's found online through the provincial concussion networks, but I believe that it's only covered under OHIP if it's an acute injury. Where can I find the Buffalo Concussion Treadmill Assessment Test? You can just find it online. So just type in Buffalo Concussion Treadmill Test, and the protocol is available openly to the public. And you'll see that in the chart, you'll see the time, the heart rate, blood pressure, symptoms, everything. So if you choose to do it yourself, by all means you can, but I would not recommend it. All right. Okay. I think that is it. So yeah, so I'll forward my presentation to BIS, and if you have any questions, my contact information is there if you'd like to reach out to me.
Thank you very much, Sonia. That was super informative. I especially like the case studies. It kind of put everything into perspective. So really appreciate all of the effort you put into the presentation, and lots of valuable information for everybody. And thank you for sharing your contact information. I'm sure that people will reach out. And just wanted to also say to everybody, thank you for coming. This Wednesday, we have our community meeting, and we'll have Mira, I'm going to butcher her last name, Gugnani, who will be talking to us about visual perceptual deficit assessment and treatment, which might be of interest to some of the participants here. And it's in our office at BIS. So we hope to see you there. You can sign up on our website. So thank you everyone for coming out. Thank you, Sonia, for coming.
You're welcome. Have a good evening, everyone.
Good evening, everyone.
Thank you.